Welcome to Middle Fingers Up, the show where we hold our heads high and our middle fingers higher. I'm your host, Kieran McKay. Today, I'm thrilled to have with us Dr. Hussain. She is a highly accomplished naturopathic doctor and a leading advocate for period literacy. Dr. Hussain is based in Canada, where she runs a successful private practice focused on hormone health, fertility, and polycystic ovarian syndrome, PCOS. We've all heard this come up many times on our podcast, let alone in our lives. She's also the founder of the Period Literacy School, an online platform that empowers individuals with the knowledge to better understand and manage their menstrual health. It doesn't end there. Dr. Hussain's work has been featured on national television. She's collaborated with numerous organizations, including Naturopaths Without Borders and the Period Purse. And all of this is to help advance menstrual health education for us. With her extensive background in biochem and naturopath, and as the author of the Period Literacy Handbook, she brings a wealth of knowledge and passion to this much needed, crucial topic that we do not talk about enough. So today we're going to do it. We're going to talk about the period. Welcome, Dr. Hussain. Thank you so much for being here.
Thank you so much for having me.
Did I get it all? Because, like I said to you, you are a big deal. You have a lot of accomplishments. You're doing so much good work for us in the community. And I just want to make sure that we included the things that were important to include in your intro. Anything that you would add?
I appreciate all the cheerleading. I think you got it all. It always sounds so interesting when it's put together in a condensed way.
When someone else says it, because sometimes it's like, oh, maybe that is a good thing. I am doing good work. Sometimes you're so, I would imagine, focused doing the work that there's not enough time to recognize the impact that you may be making. Do you realize that, the impact that you're making?
Sometimes, right? Like, I think sometimes it's nice to look back and see what you've done. But at the same time, I feel like it's also partially immigrant mentality, just like move on to the next thing, right? Like move and on to the next thing. So yeah. And there's so many other people in this space nowadays, which is so lovely. Like all the organizations, like even the Period Purse and Noontime Connections, just based out of Canada, they've been doing such great work to spread awareness about menstrual education, but also menstrual inequities, especially in northern communities. So yeah, it's definitely a team effort, and it's nice to have made a small contribution thus far, and hopefully, a bigger impact in the future.
Yeah, for sure. So where does this passion and this interest about menstrual health and education come from for you?
Probably comes a little bit from my own lack of education growing up. So I grew up in Karachi, Pakistan, and menstrual or sexual reproductive health education wasn't part of the curriculum. My first period came as a complete shock. And I really did think there was something very, very wrong with me, because obviously, like, bleeding from the inside is not a normal thing. And then the education I got, or like the little spiel that I got from my mom, was, 3 sentences about this is what happens and this is what you do, right? And here's a pet. And that's about it. And then when I started high school in Canada, then menstrual education had already been covered in elementary school in some way, shape, or form. So there was nothing I knew, like what was normal, what was not normal. And then I was starting to have issues with my periods, like prolonged periods, missing periods. And then finally, eventually, once I started university and started getting other symptoms like acne and things like that, I was put on the pill. Didn't really tolerate the pill that well. I'm definitely not anti-pill. There's a time and place for it, but didn't tolerate it myself. And the only other option offered to me was the pill and nothing else, not even like a proper assessment to see what was going on. And then I sort of self-diagnosed myself with PCOS. And also a little bit, my mom and her sisters and my cousin. Simply because like we have these themes in our family of like missing periods and cystic acne and excess dark thick hair growth on our faces and things like that, which are the symptoms associated with PCOS. And then I found a naturopathic doctor at my university. I was going to go into cardiovascular surgery, but then I switched gears based on my own experience, and I wanted to have some tools where, like, I wanted to have a wider breadth of tools, but also more like proactive tools that we could utilize for long-term health. And surgery, as you can imagine, and as you know, is a lot more reactive, right?
Mm-hmm.
So that's kind of what led me down the path, and then my own health. And I think you can only connect the dots backward. I wasn't realizing these things as I went along, but looking back, that's really part of what led me to this place where I care so much about educating others about their menstrual cycles and hormones. Nowadays, it's also combating a lot of the misinformation that we have, and supporting people with their health. And then, yeah, as I started seeing patients, that really also starts to really impact you, right? As in, like, this is a big knowledge gap, and this is what people don't understand, and this is where our focus needs to be. And here we are.
Here we are. Yeah. That's a great story. Like, even just the fact that you were going to go to school to be, getting into cardiovascular, being a surgeon, doing that sort of thing, and then switching your career paths and not knowing. And it's interesting because often what we're experiencing in our environment or, in our body or our mind are often what impacts where we're going and how we're doing it. And so that's kind of how I got into mental health. And sometimes it feels like, where would I be had those things not happened in some ways? And so for you, learning about your own health and then going to school with it, how did these experiences shape how you help your patients today? Because I'm sure you lived in the gaps, going back to Pakistan and then coming out here and then experiencing more complicating factors with it. So how has all that sort of helped you when you have patients in the room with you?
It has obviously influenced significantly how I interact with my own patients. Just even paying attention to like the dynamic nature of health and how my health changes based on what's happening in my life, the way that I speak to patients and offer guidance around their treatment plan, because oftentimes patients will come in with very distinct values, let's say, and oftentimes people are coming into a naturopathic doctor because they're either getting a second opinion or they're slipping through the cracks and not receiving the care that they need. Maybe they don't have a family doctor, which is a very common thing these days in Canada, or they are being put on a medication that they may not want to be on, but part of that is they don't know enough about that medication, right? So it's really to have, and as a naturopathic doctor, I do have the luxury of more time with patients to have some of those conversations, ask those questions that with family doctors who have a significant burden these days and a lot of time pressure basically to sort of move on and see other patients, it's very difficult for them to have those comprehensive conversations and think about their health from a more holistic way, because nothing in the body works in isolation at the end of the day, right? Like if someone's having PMS and they have mental, emotional symptoms and physical symptoms, like ultimately we need to talk about that, but also what's happening in the rest of their life, rest of their health. We still need to look at blood work to make sure there's not like a vitamin D deficiency, right? So it definitely has impacted the way I talk to patients, the way I create treatment plans, the way we make a shared decision around their health, and even just saying things like, we can revisit this, right? Like we can come back to this when your situation changes. So if like a student is coming in and they're like, I don't want to get pregnant, but I also don't want to be on the pill or other sort of contraception, then we have to have a very real conversation about like, what is most practical for you at this time? And it might be hormonal contraception because it offers you the protection that you need with your financial situation at this point in time. Whereas we can revisit this when you graduate next year. You know what I mean? Like there's how medical decision making is never easy. And that's especially true if you have a condition also. And sometimes you have multiple different conditions you're juggling. And then life is happening simultaneously.
Yeah, and I think we're going to talk about the latter, like how life is happening parallel to our menstrual cycle. And sometimes I'm sure I'm guilty of it. There's many of us that forget that they go hand in hand. And so I think we'll get there and we'll talk about that, because I think that's a big part of why we're not talking about it. It's a big part of why we're told to normalize it. But then it's so interesting because you hear, okay, normalize your period because almost all women out there get it. Then we don't normalize it to the individual. So it's on the big picture, you all get it. It happens. It's not something rare. And that's how we look at it. And so I'm really looking forward to this conversation today where we pick apart that. It's how do you normalize it for yourself, but also how as a collective do we start to talk about something that people have told us is so normal, but we do the opposite of. So it's just like, it's so weird when it's supposed to be normal, but then I can't even go to my doctor and feel comfortable enough to say I'm having this problem or whatnot. And so I'm hoping that today's episode will reach a lot of people that have had to work on this in isolation, or don't even realize that maybe there's complicating factors, which I would imagine is probably what happens when people come to you. They may not even realize that there's something more complicated maybe going on.
Yeah. And period pain, I would say, is a very good example of this, right? Like period pain, we've normalized it as a very regular part of the menstrual experience. And sure, discomfort, pressure, changes in your body are very normal because, yes, there's a very real hormone change and there's a very real inflammatory process that is happening in the uterus as part of normal menstruation. However, I oftentimes will get patients who are like, I take painkillers like clockwork for 3 days. I cannot leave my house. I have to call in sick to work, or I can't go to school, or I have to miss out on XYZ, or I'm using like 13 different therapies to manage my menstrual cramps and my low back pain, right? And because a lot of that pain has been normalized, we sometimes forget when it is normal and when it is not normal, or, especially if it is getting in the way of life. So those are the kinds of things for sure that slip through the cracks. PMS is another one that gets normalized quite often. Oh yeah, I'm just PMSing.
Yep.
And sometimes there can be significant emotional dysregulation, and we might not be looking at something like PMDD, which is premenstrual dysphoric disorder. And even with PMS, right, like because there's such a breadth of symptoms that can be part of that diagnosis, but really the diagnosis is based on interference in life, whether that's like scholastic or professional or social. And a lot of us just like suffer through it. Some of us have to push through it, right? Like obviously there's so much stuff going on in life all the time, but there's probably many, many ways that we can support these people to have smoother experiences in their menstrual cycles. So yes, to answer your question, there's lots of things that people don't realize. Oh, I didn't realize this was not part of a normal experience. I didn't know that it wasn't, if I'm bleeding through my pad every hour, that is not normal.
Right. Yeah. I'm so glad we're having this conversation. As you're talking, I'm just thinking about so many things that are being answered for me. You said the word normalize, you live with it and you've had it so much longer than not. And it's a relationship you have with your body in this particular time of the month. And again, we look at it in such different ways. In some cultures, it's about being tough. And I know like in the job culture, that's how it is. You have to be tough. You can't call in sick. The person that calls in sick the least gets rewarded. And there's women that I've worked around that are suffering so much. And you can see it, and not just physically, like it's impacting their mood, their decision making, their level of critical thinking. And when you're working a job that relies on that as a skill, that's difficult. And so it's just sad when we've had to put that away or tuck it away. And then you hear about, in women in the 40s now, I have some friends that are like, did you know that I'm only now getting diagnosed with PCOS? I'm only now learning that I'm in my 40s and I've decided to have children a bit late, that now I have all these issues that I was supposed to be dealing with, right? And so all these sorts of things that we don't know, we're not educated on, that we're hoping to change for the next generation. So can we talk a little bit about, you are the author we mentioned of the Period Literacy Handbook. What drove you to write this book? How is it going? And like, what's the hope with this?
I wrote this book primarily thinking of the person who comes to see me in my private practice. And their questions really did shape what I put in this book. So, for example, like what actually happens in a menstrual cycle? How do we make decisions around what contraceptive that we use? What do our hormones actually do and how do they interact with one another? What does a normal period actually look like? Is there like one, very rigid formula that we're looking for, or is there some variability there? And then from my own perspective, I wanted to add in a little bit of those social determinants of health, those non-medical factors that influence our health, that we sometimes don't talk about enough, especially as it pertains to menstrual cycles. And that includes things like period stigma and menstrual inequity and period products in general, and the cost of, even just using period products over the span of the year, or loss of work, or impact on menstrual cycles, or getting support. Like all of those sort of fall into that. And I wrote it during COVID. Oh. So as you can imagine, there was a lot of input from our local and global happenings, sociopolitically. And then I decided to also put in some of the common medical conditions that are associated with hormones and menstrual cycles, like period pain, like endometriosis, PCOS, hypothalamic amenorrhea, and things like that. Because again, like now we're seeing a shift in those conversations, right? As we have access to more information online, as we're having more conversations with different kinds of people, as well as media coverage, right? Like there's, for example, more talk about perimenopause and menopause and hormone therapy these days. And then I also wanted to leave people with information as to how they can start supporting their menstrual health and menstrual wellness. And it's actually very similar to how we support your overall health and wellness, right? Like it's very different to treat a condition, and it's different what we use as general wellness practices. There's overlap there, but it's not one and the same. And sometimes in the online space, things get lost in translation. And that's the other component of the book, which is a little bit of myth busting. Because there's just so much misinformation that can really overwhelm people, but also because there's that time crunch in appointments, they're unable to really sift through some of that with their healthcare providers, where it really should be happening, right? Yeah. Like that's where those questions and conversations should be happening, but a lot of them, unfortunately, are happening online.
Right.
So that's kind of why I wrote the book, plus and add to that my own history, right? Like growing up without menstrual education, it was also, I really love long form writing in our day and age of very short form captions. So it gave me a chance to really sift through what I know, where my knowledge gaps are, what I need to unlearn, what I need to actually learn, what do we know, what does science know at this point in time? Because we know the most we've known ever right now. And I'm really optimistic about what the next 5 to 10 years are going to bring, because we're seeing a huge shift in menstrual and hormone-based research.
Oh, okay. Is there anything that you could add to that? Like what we're seeing is the shift?
Yeah, we're learning a lot more about like all the conditions. Like if we think about any condition that I listed, so if we think about PMDD or PCOS or endometriosis, we've had very little to work with in the past. And now we're rounding out our understanding of those, like at the genetic level, what are the influences there? Where the prevalence in different populations, what is that like? Treatment resistance, which populations do we see that more with? How do we treat those patients? What kind of factors are involved in the development in said conditions, and how can we intervene sooner versus later? How do we catch people sooner? How do we diagnose people sooner? Endometriosis is actually a great example of this, because endometriosis, which is a condition typically characterized by significant period pain, but it doesn't have to have period pain. It's where tissue that grows similar to the uterine lining. So the lining that we ebb and flow during a menstrual cycle, that starts to grow outside of the uterus in other various parts. It could be around the ovaries. It could even be around the lungs. It could be around a nerve root. It could be a variety of different places. We have a hard time diagnosing it at this point in time. In Canada, the delay in diagnosis is 7 to 10 years. And part of that is because we normalize some symptoms. Part of it is because on ultrasound, we can't see endometriosis oftentimes. There's some instances where we can. And ultrasound technology actually is one of the things that is being worked on to map out endometriosis lesions. So we're going to see an improvement there. Wow. So there's on all levels of care, including diagnostics, care, and options, we're seeing more and more research on all of those things. And that's hopefully going to continue and support lots more people.
Yeah, that's amazing to hear. That's very hopeful. And I think, again, there's those of us in the last few generations and more where we have to just suck it up and get excited for the rest in the future. It's just that shift of not just what society is doing, but also, like you said, with technology, data, research, all of that has to be put forth. And the big thing that I'm hearing is the preventative work that we're learning through period literacy, things that we can look out for, pay attention to, be aware of, where many of us, like you said, learned in that reactive, we need to have some kind of a medical sort of response, I guess, is what I'm trying to say. This is going to be fun given my lack of coffee and sugar today. Okay, so can we just talk a little bit more about you? You talked about the book, but you've also collaborated with various organizations. How have these experiences influenced your work and the outreach? And what are you hoping, your followers, what are you hoping your patients, what are you hoping the rest of us will take away with this collaboration that's been happening with you and other organizations?
So I love supporting our menstrual equity organizations because they're very aligned with what I want to spread in this world, which is more period literacy, more agency and bodily autonomy, right? And making informed decision making. Making informed decisions for your health, and also having access to period products that can be life changing, especially in areas where there is a huge amount of inequity. In Canada, we have large pockets of our population that have poor access to period products, which has a direct influence on the rest of their health and their life. The two organizations that I work with quite often are Moontime Connections, which is an Indigenous-led organization, and the other one is Period Purse. So the Period Purse is a little bit more educational. So I've done a couple of modules for them as they disseminate information regarding menstrual cycles and periods. And with Moontime Connections, I support them with they do a lot of period product packing parties and a gathering of period products. I did a book launch. We did a fundraiser for them because they really do wonderful work. And they also teach about Indigenous ways of looking at menstrual cycles and health, which is so wonderful. Both of those organizations are great. And actually the Period Purse has if someone's looking for a period app, they have a free period app called Menstruation Nation. It does not collect any data, and it's a great app to have for tracking your periods. Yeah, those organizations are two that I just think I've known them for a while, and I know the chapter leads. So I've just made some personal connections there. So I love supporting them.
Yeah. And now you have me curious. You talked about the Indigenous ways of experiencing the period, and that gets me thinking of Eastern and Western sort of medical approaches. Can I ask a little bit about what do you think, and I know you have a bias, you're on the Eastern med side, but where do you think is the gap between the Western and the Eastern period literacy?
So I see most naturopathic doctors as actually straddling the line between conventional medicine and sort of holistic Eastern medicines. And I do call myself out on that. Even in the book, I say I have one foot in big wellness and big and big medicine at the end of the day. And I mean that critically and jokingly, but also very truthfully, right? Because all of those things can be true all at once.
Yeah.
And that's kind of how I approach most of healthcare and how I practice as well. There's a place for Western medicine and there's a place for Eastern medicine. And I think the best place to be is a combination of the two, right? Because we need the blood work to understand. We need the medications, especially where they're appropriate and where they're going to be the most helpful and give you the best quality of life. And then there's also the other approaches that can be part of the treatment strategy, but also as a preventive strategy and how we think about things. So I feel our medical model of care, conventional medical model of care, this is how I sometimes think about it. We come from a reactive model in the sense that we come from a cause and effect model, right? This is a pathogen, virus, bacterium, whatever that caused these symptoms. And then we go in and treat it. Mm-hmm. With chronic illness, we cannot treat it that way because with chronic illness, it's not a pathogen or one thing that caused it. It is all of these different things that led to the development. There was a tipping point at some point in the timeline. And that's when our symptoms started to manifest, or fully blown things started to show up. Right. And I think what Eastern medicine does a beautiful job of is like catching things a little bit sooner, and through pattern recognition, really, that's what we're using to do that. And then also like working on the different aspects of it, like the mental health component, like the nutrition component, like the let's support your digestive health, because it is going to impact a lot of different things, like the menstrual health. Like, let's look at your menstrual cycles and see like what is going on, sort of situation, right? Like, so I think like we do need to marry the two, but at the same time, the medical model is lagging behind a little bit in terms of like how we address all of those different factors. I think that's where lifestyle medicine comes into play, right? Like, there's been this huge shift toward lifestyle medicine, where we are looking at those other factors that are influencing our health. So I think I answered your question.
Yeah, you did. Yeah. I love it.
Okay. Yeah, no, so that's where I see sort of like those two coming together.
Yeah.
And that's where I would love to see more. That's what I would love to see more of, just like a combination of the two, instead of like us versus them.
Yeah. And that is how, just to say, like, that is how it feels like sometimes when I'm going to go to my family doctor, I feel like I'm cheating on them or letting them down, and don't want to be honest and say, I'm going to go see my naturopath doctor. I don't have a problem telling my naturopath doctor, hey, my family, because there's an understanding on that end of like, we kind of need both to function if we want to see the big picture, the macro. And I think maybe that's what it is. Sometimes with Western, it is micro. It's treat this isolated thing. And whereas my experience, anytime I've gone to treat something through naturopath, it is a whole, like you said, holistic, the big picture, the macro of what are the other things that could be impacting you. So the people like you are great because you'll keep trying to push that. And people like the next generation will probably also try to glue it when they start to do that lifestyle kind of way of, I'll go see someone for this, I'll go see someone for that. And so, I think maybe we're on our way to that. But before we even get to that, I think we have to get an understanding of like, what is the period, and how come we're in 2024 just learning about what is the period. So, when I Google what are the common things that we ask about our period, we ask things like, what is a normal menstrual cycle? Why do some people have heavier periods? Is PMS a real thing? Because there's so much stigma, as we talked about with that. Then I look at your book, and you covered some of those questions through your book, but you have some really good questions that align with that. And I'm wondering if we can work through a couple as we're going to start talking about menstrual and body literacy. So you get asked, is my period normal? I would imagine, is that like one of like, what would your top presenting questions align with what Google would? That's what women that walk in would be asking, like, is this normal? What would first of all bring them to you?
That's a good question. So what brings people in usually is there's something going on that they're wondering about. Oftentimes it is period pain or heavy bleeding. A lot of my patients actually either come in with a PCOS diagnosis or some kind of other diagnosis, whether that's PMDD or endometriosis, or they're suspecting because they've read up on it. So patients can come to me at different points along their journey of, self-discovery when it comes to their health and health diagnosis. But it's usually me asking them about their period and what it looks like. And oftentimes what we're going over is like the length of a period. So the length of a period on average would be 3 to 7 days. The amount of blood we're losing on average is 30 to 50 milliliters. Now that doesn't mean doesn't mean anything to most people.
Yeah.
But what that will look like oftentimes, like a regular period, is that you're losing blood within 7 days. Anytime it goes over 7 days, we're looking at like a heavier bleed, even though, the amount of blood loss might not match up. Mm-hmm. Anytime we're going over 80 milliliters, we are looking at a heavy bleed. Anytime we're going under 10 milliliters, which is 2 teaspoons, that's a light bleed. And then we're hoping that you're changing, let's say, an absorbent product like a pad or a tampon, like regular sized, every 3 to 4 hours on your 1 or 2 heaviest days. Mm-hmm. Typically, there will be like a little bit of a buildup, a couple of heavy days, and then a bit of a petering out or tapering out. You can have clots, but they, for the most part, should be small, like dime-sized or smaller. That's just sometimes the amount. the speed at which you're losing blood and some of your own genetics that are involved in that can influence it. Sometimes it can change from month to month, even a little bit, just based on like what's happened in your month, because the period is not an isolated, thing.
Oh my gosh,
happens.
we have to come back to that because
okay,
that's a surprise.
and yeah, so like the period itself, like that's what we go through, and then we go through some of the other symptoms that can happen. Like, are you feeling super fatigued? Are you able to do your regular things that you need to get done? Are you using pain management strategies? Do you have you had imaging done that might explain that? If you do have significant pain, like, do you have fibroids? Do you have polyps? And for that, like, I have to refer back to a family doctor or medical doctor because we can't do imaging. So imaging is a great place to start. Like, ultrasound is typically how we're going to do that, to get an understanding of, are there structural things that are associated with some of the things that you're seeing, either pain or heavy bleeding. But going back to bleeding patterns, it should be fairly fluid. A little bit of clotting is okay. A little bit of brown blood at the beginning of a period or end of the period is not a big deal. It's just like either slower moving blood that's oxidized, or it's just like a tiny bit of blood, so it's oxidized on its way out. The one-off period that's weird, it's probably okay. You know what I mean? Like, if it becomes a pattern, then we definitely want to investigate. But if you have one period that's just was awful for some reason, it could have even been, if you're sexually active, it could have even been like a pregnancy that got spontaneously lost. But there's so many different variations on what normal can look like. But we are sort of going for the 3 to 7 days, on the heaviest days, changing absorbent products every 3 to 4 hours, and discomfort, a little bit of water retention, a bit of feelings of pressure, totally fine, can be part of the normal process because we are shedding the lining.
Yeah.
However, like pain that is refractory to like regular painkillers, we probably want to investigate. Bleeding where, you're leaking and flooding through everything, definitely want to investigate. And even if you've seen a significant change in your bleeds, let's say you used to bleed like 3 days and now you're bleeding 6 days and also like 50% more, that's still, in my opinion, within normal range. From my opinion, but like that is within range. However, we do want to investigate as to why that change has happened for you, because 50% is a significant change.
Right. That's a lot to know without even knowing that you, like, we would probably, I would walk in and I would probably answer some of these things off the top of my head because I just naturally know, I don't, think about it. But when I'm sitting here right now, thinking about some of these things, I go back to elementary school, middle school. Like, how are we educating our kids? Because I don't remember being taught in that way about the period. To be honest, I had to go look up in encyclopedias way later because I was so much more curious about like where does it come out of even, like these are things no one tells you about. And it's so weird because it's happening to your body and you have no control and no understanding that, oh, I could look for this thing, because I think that's what we're all looking for when something's happening within our mind and our body. And it can feel like we're not in control. We're just trying to find a way to be in charge. And when someone can say, this is what you could do, like you don't have control over that part, but you can be in charge of these 3 things during, your cycle. I think a little girl growing up might be able to combat some of the upcoming more complicating things that, she doesn't even know about. But we don't start there. We start in this dark room. And we keep those lights off, and so then we're all changing our pads blindly,
Yeah, and that is difficult, I think. And you hit on a good point. We need like age appropriate information, and we get it in elementary school and then we never get it again.
Yeah.
Right. Which is such a disservice to anyone who's going through a menstrual cycle, because when you're young, you're like, okay, yeah, whatever. You know what I mean? Like it hits differently as you're in like and also like when your period starts for the first time ever, it can be irregular. It can be like light bleeding or heavy bleeding or a mix of everything. It can be painful because we might be not ovulating in some of those cycles. That is like a natural transition into regular menstrual cycles in the first couple of years. So it's also, you're in a very different phase of life and with different priorities. And then as you age into your late teens and early 20s, things are different. And then usually to something you said earlier was about the fertility issue, right? Like when people can't get pregnant, that's when they figure out that there's something that was going on, but we never talked about it, right? And that's the disservice that has happened to so many people, that we failed to give them age appropriate information as they were aging. And I mean aging very loosely, like literally aging.
Yeah, across the lifespan.
And
yes.
When they probably could have a little bit more agency over their health, where they could have implemented some strategies to support their health, or even just investigate a little bit further. But you don't know what you don't know. And that's kind of where a lot of people have been.
But is it ever too late? Is it ever too, and I know that's like a loaded question, like too late for what, but you know, what I could have known when I was younger, and now let's say I'm that, you know, person who's going to start having kids and learns through this that I had some issues with my period, my menstrual cycle. At that point, is that now going to be too late, or is there stuff that I can be doing, or are we not quite there yet? Because I know, and I'm not going into the infertility stuff and IVF stuff. Like I understand there's all this other stuff with that, but I'm just talking about my cycle. Like, is there at that age, or as I get older, can I go back and fix something or redo something, or is it like this is how my body's now adjusted?
I think all we can do is sort of pay attention to what's happening now and use that information combined with some of what you know from your past to piece together like future risk factors. Like we can do that for sure. For example, if someone comes in and they tell me that in the past that they had irregular periods and they had like cystic acne and they had the excess hair growth, but now their periods are regular and their hair growth has slowed down and they were able to conceive totally fine, we can still glean important information about them, like that we're likely looking at a PCOS diagnosis, which does increase the risk of cardiovascular disease later on in life, right? So like then we can start to look at their case a little bit more differently. When it comes to like an individual level, like what we do with this information, it's never too late to learn anything. I don't think so, right? Like because then you learn it and you can reflect on your own health and on your own past, and then you can also, like you said, talk about it with the next generation or with people around you. And then there's utility in that. How you'll receive that information is probably going to be a little bit different than when you were in the throes of things.
For sure.
But I think there's always going to be utility to learning, and maybe the depth of learning is going to be different, right? Like once you're sort of past your whatever we're thinking about at this point. But if you're in your 40s, for example, and your menstrual cycles are now changing, that is still vital information, and it's still important for us to have a basic understanding of the menstrual cycle, because now you can be like, okay, I expect there to be hormone change at this point in time. I expect there to be fluctuations, and that's going to manifest differently for different people. And my job is to really pay attention to it, right? Because if I reach menopause early, then we have a conversation about that. If I am really struggling with my hot flashes and night sweats, and it's interfering with my life, I seek care for that. Or if I'm experiencing sleep issues and mood issues, because I'm in my 40s, we can safely assume you're in perimenopause, then we want to pay attention to that. But at the same time, we also don't want to ignore the regular causes of all of that, because that's on the flip side, that's sometimes what happens. We chalk everything up to a hormone thing, whereas like maybe it's an iron deficiency and a vitamin D deficiency, or maybe you're just not eating enough or something.
Right. Yeah. Environmental, like there's so many things that are impacted. Like you even, when you jot off the list with sleep, focus, all these kinds of things that we experience with the menstrual cycle. So those are the things we have to be, I guess, looking out for, paying attention to outside of, our cycle. Am I always sleeping okay? When am I not? Or am I exercising? And when am I not? Like these kinds of things, like you said, all play a part. And I don't think we all connect that, because a little while ago, I said, we're going to come back to this. You had mentioned that there's more connected to our cycle than we let on. Can we get into that a little bit?
So I think maybe we start with like what actually happens in a menstrual cycle, because then we can see how one phase flows into the next and where symptoms tend to show up, and how we can influence them a little bit. So, and going back to something you said too, like when symptoms are sometimes there and sometimes not, my usual recommendation is throw it into your period tracking app or wherever you track your periods, because if there's a hormonal link, great, we'll know. If there's not, will also know. So that's such a great place to like put things like that into, because our memories are highly unreliable.
Yeah.
And
I forget
for sure, I
every
don't know about
month.
you.
Every month my period shows up. I'm like, right. I should go call up those 5 people that I yelled at, you know, like I forgot these things make me upset during that time, right? But every time it's a setup, I forget about it. So I hear you. Like,
exactly. Like
tracking's a great idea.
Comes, it's like, oh, right. Now I know why.
I did overreact a little bit with that. Right. You know, but then that's also where that stigma and that whole dialogue of, oh, she was PMSing, she was just crazy. And so that's definitely not what we're saying at all. I think it's just patterns tell us a lot about ourselves when we pay attention to them. And I'm only now in my 40s learning about my patterns, but it's what you said. It's the perimenopause stuff that's popping up that's making me go backwards now and look at some of those things that I just kind of lived alongside. Yeah.
Totally. And I do want to come back to that PMSing, you know, as a derogatory word. I want to come back to that too. So in a menstrual cycle, what we're looking at is cycle day 1 is your period, even though a period is actually the culmination of your last cycle. Because what happens over the menstrual cycle is your uterine lining, that lining of the uterus, the innermost one, it will shed and then it will grow, try to be ready for a potential pregnancy. And then once the brain realizes that it didn't happen, then those hormones are going to drop, and then that's going to destabilize the lining. And then we are back at a new cycle. That process is going to take anywhere from 21 to 35 days. However, if you're in your prime reproductive years, then we're probably looking at a tighter timeline of 24 to 35-ish days. That's probably what we want to be aiming for. Anything shorter than that might be indicating something. Anything longer than that might be indicating something. But in perimenopause and at the start of our menstruating life, we actually expect a little bit of those longer, shorter cycles, because at the beginning of our menstruating life, we're learning all of the hormonal things, our bodies. And then toward the end, we are running out of follicles and eggs. So it's a different process, right? So that's what we're looking at. It does not have to be 28 days. In the menstrual cycle, the average is 28 days. And even if you have like a particular number, let's say I'll take mine is 31 days. It's not always 31 days. Sometimes it's 33 days. Sometimes it's 35 days. And sometimes it's 32 days. Yes, I have a history of PCOS, but it's actually ovulation that determines how long your cycle is going to be. Because once you ovulate, once that egg is released, around 2 weeks later, you're going to get a period. So let's say I encountered a huge ton of stress before I ovulated. It's very likely, because this is my pattern and I know, my ovulation is going to be delayed and my period is going to be delayed. This just happened when I went on my trip last month, right? Like, I knew I was actually sort of manifesting it a little bit because I didn't want to get my period on my trip because we were going to be hiking a lot. And so my ovulation was 6 days later and I got my period 6 days later, right? So ovulation is really what will determine the length of a cycle. So if someone has cycles all over the place, it's likely that they're either not ovulating or they're ovulating irregularly. And that's what's going to determine that. So the first half of the cycle is called the follicular phase. Follicles are growing. Follicles have eggs in them. Your uterine lining is growing. And then you hit mid-ish cycle. So again, like if you're taking a 28-day cycle, then it's going to be around day 14. For a 30-day cycle, it's going to be day 16, so on and so forth. That's when you ovulate. And then after ovulation, you have hormones go up and then your hormones come down. It's typically when the hormones start to come down when we get those symptoms of more water retention and more cravings and more irritability and a little bit of fatigue. Your digestion might slow down. And some of those symptoms are actually part and parcel of having a menstrual cycle, because there are very real effects of your hormones changing, right? Like hormone change, your body perceives it, and sometimes it might perceive it more, sometimes it might perceive it less. You might also have this marriage of a traumatic time and your hormone change, which is what we see in things like PMDD or premenstrual dysphoric disorder. People who have gone through, there's like a relationship between significant puberty time trauma or PTSD and PMDD. So ovulation, the hormone change that happens at ovulation is really disruptive to these people, even like driving them to suicidal ideation. There's also like a lot of negative things that can happen. But for the most part, what we're expecting is a little bit of water retention. We're expecting a little bit of change in how you perceive yourself in life. Your metabolism can actually go up by 20 to 200 calories. And I couldn't tell you if you're 200 or 100 or 20 calories more. I don't know. We don't know that yet in the science. And that can also, depending on the amount of things that you feel and what else is going on in life, that's also going to change how you behave, right? And that's like that bi-directional relationship between, let's say you're super stressed out, you might get a lot more premenstrual symptoms like breast tenderness and insomnia, and a lot more cravings, and right, even insomnia in itself will cause disruptions in your appetite and how you perceive everything. You might be driven to have more caffeine. More caffeine can increase your PMS symptoms. You might use alcohol as a coping mechanism. Alcohol worsens breast tenderness, water retention, and anxiety during the PMS time, right? So it's not an isolated thing that happens. The hormone change in itself is a thing that will have some sort of impact on how you feel. But then there's all these other components, even food restriction, right? Like if we think about food restriction, which is super common, especially at breakfast time or in the morning, the common example I give is, patients have like a coffee and a banana or a coffee and a muffin in the morning. And then they have nothing until lunchtime, and they'll have a salad for lunch. And then at 4 p.m., they're like, I want everything and I don't know why. And I'm like, I can tell you why. Right? Like, I'm like, you're running on fumes. And your most busy part of the day after you've slept overnight and had nothing to eat, you are running on fumes. And yeah, your body at 4 p.m. when you slow down for a minute, it's like, hey, I'm hungry. Yeah. Please put literally anything into me. Right. And that's where we see those the craving connection too. Yeah. A, we need a little bit more calories, like I explained. And B, like we've starved our body in the first half and been on the go. So that's kind of how we want to, and that's what I tried to emphasize in the book as well, is we can't just take something and look at it on its own. We have to look at all of the other components. Now, let's say you're also iron deficient and vitamin D deficient and B12 deficient. Then you're just going to feel more crummy in those times where you're already sensitive to some of the other stimuli.
Oh my goodness. Okay. So I wrote down vitamin B and D because I wanted to specifically ask you about this. So my experience has been, we were figuring out some of this perimenopausal stuff, my doctor and I, and so blood work and those kinds of things. And, there's some deficiencies. So we give, she puts me on a higher dose than what your vitamin vial would tell you for B and D. And so I start taking it, and like, spoiler alert, vitamins, sometimes I'm like, are you just unicorns? Like, you're just magical. We take you. And what do you really do? So I go on and off of them. I noticed that when I was on them, because she was doing blood work every 3 months, so I knew I was being checked up after. So I kept doing it. I didn't notice the difference it was making until I stopped taking them. And when I stopped taking them, I realized the impact that the lack of vitamin D and B have for my mood. I get very low. And how I realized that was I went through like a very depressive couple of months where we were a little worried about me. Go back to the doctor and we realize, okay, like I have to be taking vitamin B and D. And it's so simple. It's just basic. And so now I look at vitamin B like it is some magical rainforest, like from an alien planet, thing that you go off on a journey to get from, the Lord of the Rings people. Cannot believe the amount of help it's been giving for something like my mood, which gets very impacted during my cycle, which I'm sure a lot of women probably would be like, yeah, me too. So can we talk about what vitamin B and D does for us in that time? And maybe we're shifting to a little bit of the mood talk because we talked a little bit about hormones, but mood-wise, because sometimes there's just no blood work to show that my mood, is impacting my mental health. So if we could shift there for a minute, is that okay?
So let's start with the B12 and vitamin D. And I'm going to throw iron in there as well. Yeah.
My mom every Indian mom will always remind, that's her, the last time you've ironed, just like, you're like, I had a hard day. Where's your iron at? And it's like, Mom, geez, like, it's relax. So I'm sure when she listens to it, she's gonna be like, I told you all.
I love that. Iron deficiency is one of the most common nutritional deficiencies globally. And part of that, and menstruators form the biggest part of that metric because we lose blood on a regular basis, right? Okay, so vitamin D deficiency is associated with like you name a condition and it's associated with that.
Yeah.
So if we're talking about mood and mental health, if we're talking about cognitive health long term, if we're talking about heart disease, PMS, endometriosis, PCOS, fertility, and pregnancy outcomes, like all of them, there's an association with vitamin D deficiency because vitamin D plays so many different roles in our bodies. Now, the goal there for most of us is actually just be adequate. But there are some genetic barriers, some certain pockets of our population face with like conversion and receptors and all of those things that we won't get into. Even if you live like in a very sunny area, you can totally be deficient in vitamin D because there are like other factors that will determine whether you're low or not. And really like for most people, especially we live in Canada, right? Like we probably, most of us need a little bit of supplementation because we have such long winters, but testing is the way to go. Like test and then we can supplement accordingly. We retest and then figure out a maintenance dose for you. And with vitamin D, I will say most of the time when it's deficient, that's when we'll start to see symptoms. And they can be really nebulous symptoms. It doesn't have to be specifically showing up in mood. It could be like my hair isn't growing back, or I'm losing a little bit of hair, or like I have like low grade pain in my legs all the time, right? It could be like very nebulous things that we chalk up to day-to-day life. And that's the thing with B12 and iron as well. B12 deficiency is associated with poor mood, and that could be low mood and anxiety both. And it can also, like a severe deficiency can even start to show up in tingling sensation in your fingers and your toes. And B12 sometimes is hard to get through diet. And not just that, there needs to be absorption in the gut, like for the B12, right? And our capacity to absorb B12 decreases as we age, which is oftentimes we're giving our elderly populations either like sublingual tablets or just straight up injections to support their cognitive health and mental health. And then iron deficiency. And we finally changed some of our guidelines around what we classify as an iron deficiency. We've changed it. So our bar was super low, and so many people, especially menstruators, were walking around iron deficient. But iron deficiency can look like brittle nails, bendy nails, peeling nails, poor hair growth, hair fall, heavy periods, because we actually need iron to clot properly. So heavy bleeding can worsen iron deficiency, and then iron deficiency can worsen the heavy bleeding. It can look like anxiety. It can look like low mood, shortness of breath, poor capacity to exercise. Like there's so many different things that can show up as, and that's where those foundations really are the most important. First, we work on the foundations and then see what your new baseline is. And then we start seeing, okay, what are we actually looking like? Oftentimes, like this term hormone balance is thrown around, but sometimes it's not hormone imbalance. Sometimes it's actually like a vitamin D, B12, and or iron deficiency that needs to be corrected, and you'll feel better. And then obviously there can still be other things going on, but those are the first things that we want to correct because, like, relatively speaking, they're easier to correct. Now they might not be easy to get into your day. But like iron deficiency is super, super, super common. And most people who tend to be like super low in their iron, they'll likely need to supplement in some way, shape, or form long term. But really the gauge is you take it for 3 months, recheck it. If it's not coming up, we need to switch strategies. So that's kind of how we look at iron.
Can I ask 2 questions? First one is it normal that I wouldn't know all this? Like, is that okay? Because like I'm sitting here and I'm like, it better not be my ego that's getting in the way right now. Because I'm like, I feel like I should know this. This is basic life stuff that I live with. But so much of what you're saying is news to me. And I don't want to be rude and just sit here and treat this as a seminar and just keep taking notes. But I'm so glad I have this recorded because I will be later. And then the second part to that is, so if vitamin B and D and iron deficiency can be 3 common things for many of us, it doesn't seem to be the thing. Like, are we normally, for when we do our annual blood work from childhood to adulthood, does that normally get looked at and checked? Or is it only if I were to flag it and say, I'm so tired, or I say something about it?
Yeah, and that's a good it's unfortunate that most of us don't know this, right? Like, unless we've lived through it, right? And that's maybe where your mom is coming from.
Totally, 100%.
Right. So that is part of it, and that's where I find that the role of education and my own practice comes into play, right? Oftentimes patients are going to be like, "Oh yeah, I'm always iron deficient," and I'm like, "Okay, we need to work on that." The importance of that isn't emphasized, or like why it's important, because most people, from a compliance standpoint, need to understand why. Like, what is it going to do for me? And oftentimes, like you said, it's not when I went on it, it's when I went off it that I started to pay attention, or that I felt the effects, which I would say a lot of people tend to go off like those very basic vitamins because they're like, okay, well, it's not doing anything, which then becomes like a roller coaster ride of like going up and going up, going down, where consistency would be really, really helpful. Now, when we look at routine blood work, it is part of routine blood work, vitamin B12 and iron at the very least. Sometimes it does get missed, I will say. However, they are part of normal panels. But iron, like I was saying, the bar was set so low in the past that we were telling people that they were fine when they were not fine. And even now, there is like under 30. If you're ferritin at under 30, you're likely it's unlikely that you're deficient. But if you're over 100, then you are likely. Then you have normal iron stores. But then what about those people in the middle? Like, where is the line of like normal, right? So there's such a wide range there that we sort of actually have to take a look at your iron along with your hemoglobin. So that's part of your complete blood cell count panel. And I personally love looking at those because I have a history of thalassemia. So my iron is always low and my hemoglobin is always low. There's that piece of that. And then vitamin D in 2015, at least in Ontario, and I'm pretty sure I can only speak about Ontario, but I don't think it's covered for you guys. Is it covered under your provincial plan?
I don't think it's actually covered, but I know it became a big education in 2014, 2015, I remember in particular, but I don't think it's part of our plan, but I could be wrong. Okay, I'm sorry if I am.
Across Canada. Yeah. And I don't know, I'll speak for Ontario, but in 2015, and I'm pretty sure it might be federal, vitamin D stopped being covered unless you fell into like special populations, like you were osteopenic or osteoporotic, or if you were on medications that affected your bone. That's typically where we see vitamin D testing being covered. And now vitamin D testing was no longer covered in 2015 under OHIP. So it stopped being part of like routine testing or even testing when it was necessary with the blanket recommendation of just take 1,000 IUs per day. And then recently we saw a change of that maintenance dose change from 1,000 IUs to 2,500 IUs. But again, like, I don't know if you need 2,500 IUs or if you need like 5,000 IUs for a short period of time to bring you up, or maybe you do need 1,000 IUs because that's your maintenance dose. So that's where we are right now, where we usually have to ask for vitamin D, and then we also have to pay out of pocket or have our private insurance cover it. If we have access to that, it's $45 in Ontario. I'm fairly certain it differs from province to province if you're running it. So that's what's happening there. And then there's also like our teenagers, I find that are oftentimes just not tested. We don't test them.
Yeah, there's such a weird zone where like, we'll get back to you when you're 18 or 20. Like, yeah. But
exactly. So unless you're going in with a problem, they're not testing you. And that's usually on the parent.
And the thing with teens too is it's easy to miss because they're just always lazy and tired and sleeping, which they're supposed to be because they're growing. But then, we just chalk it up to behavioral. And I think that's a lot of when you're explaining some of these symptoms. And when I was like, is it normal that I don't know this? I just kind of read between the lines of a lot of what you were saying and thought, oh yeah, that can be behavioral. And we live in a society where that's how we look at things, like just be fine. And, everyone gets their period. And so I worry about that for like marginalized communities that don't have access in the way that maybe you and I would, where we can get a handle of this or be curious about it because they're such basic life needs. These deficiencies that you're talking about are easy fixes. And they impact us. Like it's the foundation that you're talking about. If I can't function because I'm tired or not feeling with it, and those kinds of symptoms, and how do I get to school and focus and pay attention? And so then we wonder about ADHD and all these other things too. And there's like a huge, what's the song? This bone is connected to that, but like that's life, right? Like the things that are going on in our environment, whether it's on the outside or the inside. So I think that's tough when we could have access to these kinds of things, and we don't know that we can, or we don't know that we need to go and look at that. So that's a hard
and honestly,
one.
I do think that there are some simple ways as a healthcare system we can start to implement that, right? Like even just like simple fact sheets. I know like not everyone reads them, but at least like there's an attempt to like teach something that, hey, this is what iron deficiency looks like. It's very common in your particular population. If we're talking about menstruators, for example, as a whole, and that catches a lot of people, right? Or this is what a vitamin D deficiency looks like. I think there can be a lot more strategies that we utilize, but I won't talk so much about our broken healthcare system.
Well, I mean, like
there's a lot to be said there.
Do you feel like that social, because we're talking about, literacy, body literacy, menstrual cycle literacy, and social media can play a huge part. There's probably great things with it, but with all great things come not so great things. So what's your take?
That's where I was getting to earlier on when I said like big wellness. It's a big industry at the end of the day, especially at this time. And if we look at like future projections for like wellness trends and companies, and like as you mentioned, like the celebrity culture around some of these things, it is big business at the end of the day, just like how we find that in conventional medicine, but we've pointed it out a lot in the conventional system, but we haven't done that or been as critical of big wellness. Maybe the medical system is a little bit more critical of big wellness, and that's what I meant by like, I straddle both worlds at the end of the day. And I don't like, I'm not like benefiting from, financially from like recommending one brand over the other or anything like that. But you're right. In this day and age where people are under supported by their healthcare providers or don't have access to healthcare providers, and some of like the discussion pieces about their healthcare, they are turning online, and online everyone's an expert.
Mm-hmm.
And that's the hard part. Is also really difficult. And we can see this in the political world right now, right? Like, who do you trust? And it's very easy to plant seeds of doubt. But I always like to go back to the foundations, and that's how I present it to patients. And that's typically the patient I'm attracting to, who wants to have A, real conversations, and B, they want to really like get into overall long-term health, not just like the quick fads. I feel like I have patients who will like even bring in the questions that they have. They're not blindly following. They're like, okay, can we talk about this thing that I saw on TikTok?
Oh,
I'm not on TikTok, so but
too.
I get a lot of patients. Hey, I saw this on TikTok. Can we talk about it? And I'm like, sure, because I'm really a little bit out of touch there. But which is great. Like, I love that my patients do that, because I don't want them to go blindly follow someone. If it sounds, then great, right? Like if they're recommending, I don't know, if they saw something like a happy light, and does this actually help with mood, or something like that, then we can talk about it. Or, I saw this oil that has XYZ ingredient for hair growth. Is it actually helpful for hair growth, or is it just like a nice oil for my hair? Right? Like, and those are the kinds of conversations that we're having. So I think we do have to really put on our critical thinking caps as we're exploring some of these things, because I think we've all fallen prey to marketing, myself included, right? Like, marketers know what they're doing, and so do a lot of influencers and celebrities. They know exactly what they're doing and what that's going to do to a brand or a product. So is there well-intentioned misinformation out there? Yes. But there is also like predatory marketing at play, and some of it is, again, well-intentioned to like sort of make a buck, and some of it is quite predatory. And I always want people to, use their hard-earned money judiciously and on the things that are actually going to be supportive. Like, if your iron is low, then you don't need like a special gummy formula with like a tiny bit of iron and a bunch of other things. You just need straight up iron, right? Like, So I will say, like, it's very difficult in this day and age with just you being bombarded by information from all sources and trusting based on how people present themselves. And we have regulations, right? Like, I can't, let's say, like, if I like a certain brand's product, just because I like the ingredient profile and it matches what the science says, then I'm not going to be promoting that on social media, right? I have rules around that. I have regulations around that as being part of a profession. Whereas like unregulated whomever.
Yeah.
They can say whatever they want.
Yeah, I can literally get behind that and do that right now and sell all of that. And so can all the other people on there. And so then what do you recommend to your patients when they come in with these videos, like in terms of what's a credible source and what's not? What do you have suggestions about what we can look out for so we're not getting conned into that, or, you know, missing a step in dealing with our health? I think that's what I worry about the most, is if you want to spend hundreds of dollars on something, okay, but did you lose time there where you could have gone to an appointment and, you know, checked it out and made sure you were okay? Because again, prevention, right? The sooner we get in, we keep saying the better it is for us. So do you have suggestions for us about how to manage some of all of that information out there?
Yeah, I think what you said earlier, like if it's too good for it to be true, it's likely not true.
Yeah.
Like that's a good strategy. I'm also a little bit of a cynic at heart, I will say.
Yeah.
And maybe that's my husband's influence. He really thinks everyone is trying to scam everybody.
Because most
it's rubbed off on me a little bit.
Yeah.
Yeah. I used to have like blind faith in a lot of people. But yeah, I think like that's how you want to think about it. And then think about like sometimes we misascribe meaning to the wrong thing. And to clarify, I mean, like, let's say let's go back to like some of those deficiencies. Let's say you're feeling moody and you're feeling low and you're feeling anxious and you're not able to sleep and you're having like heavy periods, and someone comes up and they're like, oh, you might have a hormone imbalance. And that sounds like, oh my gosh, yeah, these are the signs of hormone imbalance. Like they're affirming what you're feeling and then they're selling you something. Mm-hmm. That should raise a red flag that, okay, they're trying to sell me something. If they're trying to just educate, then that's a different story. But look for general terms as well. Like hormone imbalance doesn't really mean much. We can probably define hormone imbalance like way better. Like, is it PMS that we're looking at? Are we talking about like irregular moods? Mm-hmm. Are we talking about like hot flashes? Like what are we talking about? Are we talking about a group of symptoms? And then this is where, if you're listening, this is where tracking some of your symptoms really comes handy. We're like, let's take an inventory of how you're actually feeling, how frequently you're feeling it, what intensity you're feeling it at. Are there triggers? Like, is it because are you feeling a headache every time you have an argument with your partner? And you know what I mean? Like, what are the patterns here? Because we may be just misascribing what's the cause or what's the trigger. Or let's say you have a migraine. Let's say you're someone prone to migraines or headaches. And every time you drink caffeine, you're like, oh, I get a migraine or headache. But the only time you drink caffeine is also when you don't sleep. Lack of sleep, big trigger for migraines. So is it the caffeine or is it the lack of sleep?
Wow, said.
Right. So like that's kind of how we want to think about these things. Like, can we get a second opinion? And I think that's where most of us, it will be better to just allocate a little bit of funds to talk to a healthcare provider, or if you're in a public healthcare system, obviously just book an appointment.
Yeah.
We're talking to someone about it and just getting their point of view, like an objective point of view, might be helpful to talk through it and then make a decision or investigate, right? Like maybe there is something really going on that we need to address medically versus just spending your money. I think most of the problem, going back to, I think I said this before, like when are we treating and when are we working on general wellness? Like if we're treating, then we likely don't want to be getting our information from like random people. We're likely going to a healthcare provider. It's like when we're trying to like improve our health or nebulous symptoms, that's usually when people are falling into traps of buying things that don't work because we're feeling okay, but we could be better.
Right. Yeah.
But I would argue even these people probably need to speak to a healthcare provider, do like a regular, like routine blood work to see is your iron low, vitamin D low, or something like that. What else is happening in your life? So those are my 2 cents. Like you're likely better off talking to someone, a healthcare provider. And there's nothing wrong with having multiple healthcare providers. I will also say that I usually am part of a team. I always want my patients to have a family doctor. I always want them to have a specialist if that is appropriate for them. I want them to see a physiotherapist if they have something musculoskeletal going on. I cannot wear all the hats. I know I especially as I practice more, I know my boundaries and limits of where I shine and where it's beyond my scope.
Right.
And where I need someone else to step in. And I think as individuals, we need to do that a little bit more as well. Like, okay, can I trust this person Like, what are their credentials? Like, what is their background? Are they just sharing their story? Because ultimately, we can all have very similar symptoms for very different reasons.
Absolutely.
Right? Like,
yeah.
Same thing with PMS, like something like PMS, if we're going back to that example, where we're having, let's say, like you and I have the exact same symptoms. We have breast tenderness, we have headaches, acne, and insomnia. You and I could have literally the same hormone levels. We don't diagnose PMS based on blood work. We diagnose it based on what you're sharing and what has happened over multiple months, because we need a pattern to be happening.
Right.
And it's also like disrupting our life. Right. You and I could have the same symptoms with very different hormone levels. We could have the same or different vitamin D levels. It's really like when we're looking at individual health, we really do need to look at the individual as to talk to you and run the testing, marry the two together, and see what needs to be done.
It's like the one time in life where we're saying don't work as a collective. Like when it comes to your health, look at it from an individual perspective. Absolutely, because you're right, and I think sometimes we just share, especially those that maybe don't feel comfortable going and talking outside of a close friend or sibling or something about their menstrual cycle. Then when we share, well, this is how it is for me. That's how we learn what is normal, what's not. And again, that may not very well be the case, as you're saying, because even when you use example of tracking, what I really like that you said was, like, we're trying to get to the beginning of a story, and often we start in the middle. And so if I'm tracking and I'm realizing the example with the caffeine, the headache, and then I didn't sleep, but my mental health, background kind of comes up with, okay, then why didn't I sleep? Was it because I got in a fight with someone? Was it because I was stressed? Was it because I was worried? Was it because I was in a different environment? Is it because I partied too hard? It was by choice or what? Those kinds of things. Like, I really hear what you're saying is get to the beginning, because there are ways to learn our patterns, and those patterns will help us hopefully manage in the context of our menstrual cycle, which is kind of why we're here today. So it's starting to connect in the way of, okay, I used to track when I was, my end game was to get pregnant. And so that's when many of us do that. But I haven't tracked ever since. And I've only now in my calendar, I'll write day 1 so I can count the days. And that's mostly so I can plan my life around, I'm going on vacation as well. And do I need to take extra tampons or, the airplane and all that? But actually, you know what? Now that I'm just mentioned planning my life, maybe we can spend a few minutes, if you don't have anything to follow up, about period syncing with her life. You and I had a funny conversation about that. I thought you were talking about something completely different. And I learned from you that I didn't even understand what period syncing meant until you had brought it up. So my version of understanding was what us office mates would talk about, where, we're all following the same cycle. But that's not what we're talking about. Is this a good place to bring that up? Because we're kind of talking about lifestyle and life and how we build around our menstrual cycle. So yeah.
Yeah, that was a funny conversation. You were talking about like periods lining up, and that is like the historical way of how we used, cycle syncing as a term. But in this day and age, like, cycle syncing also refers to like changing up some lifestyle habits depending on where you are in your menstrual cycle. There's many different ways to do this. And again, like, I have a whole section on this in my book because I wanted to really address it. Because again, like, there is a lot of like, take this supplement that we sell, or tea that we sell, or program that we sell, right? Like, around this. Again, some of it is rooted in, let's teach you about your menstrual cycle, about your body, which is wonderful. And I think cycle syncing, one of the things that it has done, like, as a whole, is bring more awareness to how people are feeling differently in different parts of their menstrual cycle, which is great. However, like, I always want to lead people back to the foundations, right? Like, if, let's say, in the second half of your menstrual cycle, especially in the lead up to your period, that's when you feel, let's say, the crummiest. Cycle syncing sometimes tells us to like not exercise, or like do lower impact exercise. But if we take a look at our society as a whole, we don't exercise enough in general. Right. So now what we're doing is we're telling people to do low impact exercise for like 7 to 13 days of the month, which is like literally half the month. Yeah. We're telling them to only do low impact exercise, whereas long-term health will say, and our exercise guidelines say, hey, we need to be exercising more. Like, we need at least 150 minutes of like moderate to rigorous activity on 3 days a week per week for better long-term health, to reduce the risk of heart disease and cancer and cognitive decline and bone loss, right? Like, for these things, we want to be exercising. So that's where the disconnect comes, or like eat this way in that part of the menstrual cycle, when our baseline nutrition could be better. Most people don't get enough fiber. Fiber only comes from plants, right? Like, we're adding layers of complexity when we really need to just get down to the basics, start there, and then we can add in layers to that afterward, no problem. Right? Like, if someone is already doing, like, they're eating enough for their body's needs and they feel okay and well, and they have a good grasp on like doing whatever they need to do for their long-term health, then great, we can add in complexity, no problem. But what we're doing is like, we're adding in all these different things in the lives of people who are already busy and have, so much pressure on their time, that we need to simplify and make more practical. So in the second half of the cycle, what we do is the same as the first half of the cycle. Maybe eat a little bit more. Maybe take a few things off your plate just so that you have the space to take care of yourself. And I think that would go throughout the whole month, that we as a society, I think, do need to take a step back and maybe get off our phones, go for a walk, go outdoors, like pay some attention to our bodies and ourselves and our minds. And I'm sure, you talk to people about that all the time, being in the mental health space. And that's what we need to focus on and have conversations. So going back to something that you said that I did want to add to is the conversations that are happening online. There is such huge power in having those conversations, because it helps us understand what other people are going through. It gives us a chance to reflect on it. And when it comes to PMS, like, if you share what you're going through in your life at that point in time, then that's actually a better way for other people to understand what you're going through and maybe accommodate you a little bit better. Maybe not always, but sometimes.
Yeah.
And also, if you're asking for help, you can be like, hey, it's that time of the month. Like, I just need a little bit extra help right now. Or my patience is a little bit thin right now.
Yeah.
Right.
Yeah.
And we even have studies on this, that when in a heterosexual partnership, when people with PMS share their experience, their PMS gets better.
Yeah. I believe it.
So there's so many things we can do. And I think cycle syncing, some iterations of it, not all iterations of it, some iterations of it have just like really gone off the rails.
So maybe the cycle syncing, really, your next book is about getting our partners and our environment to work with, where within our capacity, versus us trying to, move things around or what. I have a funny story about, so I have 2 boys, and I struggle with my mood, and I know it's harder during my cycle, and so do the people around me. And so I decided a few years ago that I was going to kind of re-script this with my kids, because I didn't want them thinking, quote unquote, the buzzwords of mom's crazy, or why does mom act this way? And then, they're watching shows like Modern Family where they talk about the girls in the house and the mom's, period. So I thought, they're going to learn about this. They're going to learn about it at school. So I had a full out conversation with them and explain to them about what it is for me. Like, this is, many of us get it, but in your house, this is how you're going to see it. You're going to, my anxiety goes up, and then I'll start cleaning more. And you'll see that when I start to get irritated, and I get irritated, it looks like this. So I just kind of broke down. I have a lot of cravings for sugar. So all these kinds of little things I broke down for them, and how many days it'll last, and what I need from them. Like, I need patience, and I need help, and I need extra brains around. So, my kids are only now 13 and 10. So this was quite a few years ago. They were a bit younger, but it was so funny because they understood it. They were like, oh, okay, that's cool. They're very respectful, whatnot. And then there was a rough month. I'm in my bathrobe. I've got the drawer to the candies, that we have open, and I'm just in there eating it. I got the pantry door open, and I'm just stuffing my face with junk. And my son comes around the corner, and he's first like, "What are you doing, Mom?" And then he looks at me. He kind of steps back. He looks at me, and he kind of inspects. He's like, okay, she's wearing a bathrobe. Her hair's everywhere. She's eating all these things. And he had this aha moment. He's like, oh, you have your period. And I'm like, yeah. And he's like, what day of 5 are you on right now? And I'm like, I don't know, like 2 or 3. And he's like, okay, we have a couple more days to go. You got this, Mom. Don't worry. Just relax. And he kind of walks off, and I walk out into the living room. My husband and my brother are sitting in there, and we're all like, oh my gosh, because, you know, they're also boys. They grew up different about periods, and here are these guys picking it up, learning it, and going with it. And so it just kind of brings me to that place of, you know, what kind of conversations can we be having in our own house while we're trying to make sense of our period. It's complicated. It's tough for others and whatnot. But the reality is certain symptoms are occurring. Certain behaviors might be occurring. Certain physical ailments are occurring, and it's happening regardless. And so instead of stopping it or working around it, which I think, you know, much of my life was working around it, it's like, how do we just meet it where it is? And that's why, you know, I was like, I got to share the story, because I do find when we're all attuned to it, it feels like it's not just me having to deal with the things that upset me in the week that, you know, come up. Everyone's kind of, maybe they think they're walking on eggshells. I don't know. But I would think that we're all, you know, okay, let's work through this together. I find it very helpful, because it's that, or everyone's going to get yelled at all day long for, you know, ridiculous things that no one should get yelled at for all day. So, but I just thought I'd share that, because that was like a really big moment in our house of, you know, me being the only lady in the house and think, okay, we gotta talk about this. Thing happens a lot. So now the boys know, oh, Mom's got her period. Okay, we got you. All right, okay. You know, so that's kind of just an everyday sort of understanding of when it's happening.
Yeah, and I think the tides are turning, right? Like, because our parents' generation, there was a much bigger stigma talking about it, or just like, you know, shoving it under the bed and really just like whispering. Even the word period, it took me personally a long time to even just say it out aloud. And there, you know, my uncle and my dad were at my book launch, like waving my book. Like,
isn't that amazing? Like, right? Well, but yeah, even so many religious institutions, there's a whole conversation about how a woman has to be prepared to not attend the sacred space. And that's always been a struggle for me, because it's been a big part of why it's not okay. And it's also something we don't have control over. It's also, you know, supposed to apparently help us have babies and these kinds of things. And yet we're just right away, you know, saying you're not allowed and all these sorts of things. And I don't obviously want to diss people's religious institutions and all that. But for me, that was always disheartening, was like, I didn't have control over this, and now I can't attend this. And
totally,
we're talking about it without we're talking about it in the worst kind of way, you know, like, you know what I mean? Versus just just don't bring it up at all. Like, so those things I think impact, of course, our moms and our aunts and grandmas, and yeah, like never talk about it.
And even us.
Yeah.
Right. Like through osmosis, it's definitely impacted us as well. And there's so much to unpack there, because culturally, religiously, there's so many different practices. Even if we look at like anthropology studies, some places it's celebrated, some places it's like a time to connect and really tap into feminine energy and things like that. Sometimes some places it's like dirty and you're gonna like ruin the crops.
Yeah.
Right? Like, there's all kinds of different stories, and some places it's like neutral, completely neutral. It's just like, this is a fact,
right?
Which I think, like from a medical standpoint, at least, like that's how I look at it. It is a fact,
yeah.
But it's taken me a very long period of time to really dissociate some of like the cultural religious aspects of it, which aren't inherently bad or anything like that, but like our brains are interesting, right? Like they fill in the gaps so weirdly.
Mm-hmm.
And then like the hush hush culture, and then if you think about like the patriarchy and like how like the roles of women in South Asia, right? Like I grew up in a country that is one of the worst countries for gender disparity, right? Like Pakistan is like one, like I think it's like second after Afghanistan or something like that, right? Like it's in like the top 10, let's say, when it comes to gender disparity. So like then we start to connect all of these things into one, and they become a facet of one of the same thing. So I think that's really hard, and it also makes it difficult to then talk about like in so many different ways, even with medical providers. And I think like talking about it like a matter of fact is the way we need to start, right? Like talking about it like you talked with your son, and making it a conversation. Do they have questions about it? Like perhaps even there's really nice resources in this day and age, at least from the government, but also like independent people writing books that are for different age groups.
Mm-hmm.
This is like a little bit of a tangent, but not really. I don't know if you've seen some of those videos where people go around and ask different people on the street questions about like women's bodies or just reproductive health, and they're like, if someone has a tampon in, how do they pee? And then like you see the people, they're like stumped. They're like, how do they pee?
Yeah, what do they not pee? Yeah, what? Yeah, yeah,
yeah. So like these are the conversations that I think that we just need to be having a little bit more, because it doesn't pertain to certain people, right? Like menstruating people typically we're going to be looking at women. So there's just so much that is maybe siloed into like, you know, the different kinds of reproductive anatomies. We're talking about it very separately. So like it doesn't pertain to me, so I'm not going to learn about it or pay attention to it, but really it pertains to everybody. And I think the way you've gone about it is a good way to go. Like have a conversation, like how do I act? Like, and sometimes the feedback allows us to understand that maybe we need care.
Yeah.
Right. And this is what I hear from my PMDD patients, especially that my partner or my kid or my parents is that I am like a completely different person in the week before my period.
Yeah.
It also allows us to get some feedback as to, okay, right, because we obviously look at it from our perspective in a biased way and they're looking at it from their way. But I do think like just conversation in general, and if you see it's like something being represented in an interesting, for lack of a better word, way. Let's say you're watching a show and they're talking about PMS as a derogatory term, like that's a great time to like hit pause. Can we talk about this for a second?
Yeah.
Right, that sort of situation, because like these things most of us learn through osmosis.
Yeah.
Right, like not in really like going into it and let's learn about this.
Yeah.
It's and we know like women oftentimes have been portrayed as like hysterical and all kinds of things. So it's unfortunate, but conversation and openly talking about it and addressing misinformation and some of the language that's being used, I think that is the way to go. Like there really is no other way.
Yeah, I appreciate that. I think, and even, you know, when sometimes you look at stats and what, I was just curious where in the world supports days off for your period, and nowhere in North America. And, you know, Japan was like the first place in 1940 something. And then Spain was the first European place. And there's many different places, even in Asia and whatnot too. And it's just so interesting, I think, when from a bigger picture, when we're talking about a certain health matter and we just look at facts don't lie, look at stats and numbers. And when you see skewed numbers, you don't see a whole lot on there. I think that also generates a conversation of we don't have access to that kind of care with our sick days or what, but also we're so behind on many of these things. And we're living in North America, a very privileged place where we have access to care for our periods. And so like, I never want to speak poorly of that, because I know in India, as you talk about Pakistan, like there are so many countries where this is just not a conversation for women, or it's happening in different ways. And kudos to the ones that are fighting and sticking up and saying, period, like, let's talk. I just sometimes think we could do so much over here to help overseas and be a collective in that way. And so sometimes for people, I think even with the podcast, when they're like, why are you guys always talking about these things? Like, just get over it. Like, we all grew up fine. We turned out fine. And I think that's fair to say, but I also think we're trying to learn from things that we were just trying to make sense of in the way that we figured it out. And in our head, we said that was fine. And that's not necessarily helping us if it's getting in the way of being diagnosed with, you know, like you said, chronic illness and health issues that some woman is living alongside. You think of how many moms and grandmas have had these issues and never had answers to that, right? Like, we're pretty fortunate that we get to sit before someone like you and have this kind of conversation. So I appreciate that.
Yeah, thank you for having me. And yeah, honestly, like, I think you're right. Like, we can acknowledge our privilege and still want more.
Yeah, for
everybody, right? Like, and it's kind of like, you know, someone else's happiness shouldn't take away from anything else.
Yeah.
And just because things are worse or better in an area doesn't mean that we can't work towards something better. Totally. We can acknowledge, you know, the strides we've taken and still want more and work toward more.
Yeah, I agree with that. And I think that's what it is. It's never to look back at the past and say, oh my God, we're so terrible. It's like you said in the beginning, we have more knowledge, we have more resources, and let's utilize them and see where they'll take us. So maybe we can pause for a sec, and as we're concluding, let's do our middle fingers up, because we got into conversation and I was like, I'll just do this at the end because I didn't want to break it up. What would you like to put your middle fingers up to today as we're concluding?
The middle fingers up to something we've already talked about, which is normalization of period problems and not talking about them and not getting care for them and just living with them without actually even trying to get the care for them. Because I think that has been the case for a very long period of time, and it continues. It's improved, but we still have a long way to go.
Maybe I can even just tag along too, because I'm literally waiting any second to get my period. So it's on my mind. And my husband and I were on a really nice trip, just the two of us. And we were at the airport just about to get to the flight to Calgary. So like right at the end, this was a very romantic, great, the two of us, fantastic fairy tale land trip. And we're in the store in the airport, and we have this funny interaction. And we haven't had this the whole time we've been away, but we have it now. And it's me misunderstanding something he's saying and really taking it personally. And then like this paranoia starts to kick in with me thinking, well, what if he meant it this way and that way and that way? And so my middle fingers is going up to just that, the impact our mental health has on our period, and our menstrual cycle has on our mental health. And those two things do go hand in hand. And I'm learning more and more, because in that moment, he and I were both able to stop, and he's like, what's going on here? And I'm like, I don't know. And I don't want to just sound like, a cringe here and cliche, but I think I'm getting my period. And so I go and look at my calendar. He tells me after he also went, look, because he also tracks it. I found out at the airport. He came back with a chocolate bar for me. And we had a little chat about, oh, okay, see, this does happen. Interesting, because he's pointed out this script that comes before me, this imposter syndrome kind of script, where I'm nothing, I'm terrible, that kind of thing that we go to. And I never ever connect it to that time of the month. I just think, no, you're making me feel this way. Stop behaving that way. It was a good moment to, when you have support of your partner or people in your environment, to sort of look at these things that you're living alongside and think, oh, okay, because it was encouragement for me to want to do better too. Keep it together, figure it out, understand it was a misunderstanding. There's a bigger picture to why I'm feeling this way. And then we can enjoy the rest of our, 12 hours left on this holiday. And so my middle fingers is that just underestimating the impact our mental health and our time of month have on each other. And I think having a little bit of self-compassion in the menstrual cycle, I think, is a great ingredient for, at least for me, working through that. So that's where my middle fingers are. So just perfect timing with you, is I'm like, any second I'm going to get it. So is there anything that you wish that we did talk about that, we hadn't, maybe something that you and I were talking about when we had our prep call, or something you want to go back and add to, clarify before we get to our call to action?
Honestly, we talked about so many things that I don't know if I want to go back and clarify, but I do want to pick up on your last point about self-compassion. I think sometimes we can get down on ourselves about the things we didn't know or didn't do for our health. And I'll just leave everyone with a reminder that you do the best you can with what you know at the present point in time, and then you do better when you know a little bit more. And that's all we can do. There's some things that are under our control, and there's some things that are not going to be under our control, and that is part of life. It's part of health, and that's okay.
Oh, that's well said. I appreciate that. I think that's a lovely way to make sense of sometimes the wildness going on in our minds and outside of our minds, of just like, okay, what can I be in charge of right now, versus stopping this feeling or whatever it is that's happening. One thing before we do the call to action is, if we could just touch on, if we talked a little bit about the fact that sometimes it's hard to go to our doctors, or if we don't have doctors. So maybe we can leave with a strategy, just if we're preparing to speak to our doctor, any suggestions about how we can present some of our, menstrual cycle issues?
Yeah. So I think once you have some tracking data, and again, like we want to rely on trends, right? Like a one-off experience. If it's like a really disruptive experience, obviously please go to your healthcare provider. But really what we're hoping for from a longer term understanding of your health and your periods and your menstrual cycle and hormone health, we actually want some trends, which means that we need a few months worth of data. And then the kinds of things from a period perspective, you can be looking at how much blood am I losing? You can quantify that with the period products you use. If you have a cup or a disc, you can take a look at the volume, obviously, that you're discarding at the end, how many days it's lasting. If you have pain, the intensity of the pain, like we really like scales of 0 to 10. If there's any impact on the quality of life, like if it interferes with things, what management strategies that you use. When it comes to mood and stuff like that, same thing. Like let's say you experience mood disturbances after ovulation or in the 3 days before your period. All of those things, if you have them written down and tracked, then you can actually just summarize them in like 3 succinct sentences, right? Like, I've noticed that my periods have gotten 50% heavier. I used to use 3 pads on my heaviest day. Now I use 6 pads. My pain has gone from a 3 out of 10 manageable with an Advil, but now it's like a 7 out of 10, and the Advil only takes it to 5 out of 10. Right? Like we can summarize that very succinctly. And then pose the question, what can we do? Or can we talk about this? And then let them ask some questions, because they likely will have some questions. I hope they have some questions. And then if they're not offering anything, then be like, okay, what can we do about this? Can we investigate this a little bit further? Sometimes they need the prompt. Sometimes they need a little bit more context. And sometimes they might just be like, hey, I want you to go back and track X 2 more months, and this is exactly what you're looking out for. Or let's send you to a gynecologist, or let's do an ultrasound. Like, pose the question first, and then let's say you are hoping for an ultrasound, and then you can ask the question more directly. Can we do an ultrasound? I'm wondering if I have a fibroid, because my friend has a fibroid, or my sister has a fibroid, right? And then that's the other thing. Family history sometimes makes the difference between a certain plan or route that we're going to take, or another plan of action that we're going to take, right? Like if you have if your mom has like a thyroid disorder, let's say, and your periods are super heavy and they're all over the place, then maybe we do some more robust thyroid testing, right? Like that will also, so even remember, your doctors are human. And again, family doctors have a huge load on them at this point in time. So the more information you can succinctly give them, the better it's going to be. And then you can ask the questions that, hey, what about this? What about this? But let them ask you first, or let them share their clinical judgment or assessment first.
Well said. And I really like what you said towards the end there too, about it is, on one hand, a nice way to encourage us to talk about it when we're just even learning the medical history through our family members. So, like just the fact that the stigma of talking, but knowing that your history can help so much prevention as well. And so it's worth having that conversation with our moms or grandmas, whoever it is that, was help provide care for us. And then knowing about our genetics, because sometimes it's so funny, like we don't go there, but those are the things that can actually help us learn where we need to go next. So well said.
Absolutely.
And call to action. If there's one thing and only one thing out of everything we talked about today, what would be that one thing you would hope your listeners will take with them?
Go back and listen to the episode. Again. No, I'll say write things down, because our memories are imperfect and they change over time. And that's going to give you a good track record of what you've been experiencing. And it allows us to connect the dots we can only connect the dots looking backwards. So write things down and track your periods.
Perfect. Awesome. Okay. So where can folks find you? You have a great Instagram handle, lots of information, lots of education. Where could people find your book? So help us out. And we'll also have it in the show notes.
My Instagram handle is dr.hussain. That is really the only social media platform I'm active on. You can always check out my website, which is annhussain.com. If you're looking for period and like endometriosis, PMS type of like informational guidance, then the periodliteracyschool.com has free and low cost and pay what you can options for some programming there. And then my book is available at most retailers online globally. Amazon is probably the easiest place. It's available in paperback and ebook, and audiobook is coming later this year.
Oh, awesome. That's cool. I was just thinking about the book. I was like, I'm going to get this. And I think this is a great gift to give like young girls that are going to go into their, next phase of their menstrual cycle. You get diaries and we get little gratitude books. I think your book may be a nice gift to give to help educate young girls. So Maybe I'll have to buy like a little stack of them so I can hand them out to whatever girls I have in my life, I guess. Maybe even the guys, so they can learn about that as well. My unfortunately my boys are going to have to probably now go through it and read it, so lucky them. Okay, so I just want to stop and say thank you. When I first started this podcast, this like over 90 episodes ago, my very first episode, I talked about my MFU was period related. And then my second episode was with two really good friends. And we talked a lot about both two of the three had a period related MFU. And we talked about, this was one of my really big goals, was having an episode, but the timing and then who to do it with, didn't work out until you came into my life recently. So I'm so grateful that we connected. And I'm really hoping that this is the beginning of more opportunities to sit down with you, because there's so many more things that I'm sure we could have covered that you could have covered as well. But one episode at a time.
Yeah, I appreciate, you spreading awareness and having some real conversations about all kinds of topics, but specifically hormone and menstrual health related. And I am so happy we connected too.
Yeah, awesome. Okay, well, we're going to talk soon. For everyone else listening, as you know, these conversations are door openers. If there's something that you'd like to add on to this conversation, or if you have questions, please let's keep this conversation going. Send us your feedback. You know where to find us. You will also know where to find Dr. Ann as well if you have questions for her. The important thing is that we don't stop talking about it. So thank you very much for listening. Thank you again, Dr. Ann.
Thank you.